Hi, my name is Dr. Lynn Zaremski. I'm a cardiologist at the Mount Sinai Doctors Medical Group. I'm often asked about screening tests to evaluate for the risk of heart disease and who should get tested. So I'd like to discuss with you a few options. There's no specific age at which we recommend a particular type of screening test for your heart. So deciding when is the right time to see a cardiologist to discuss your risk can be tricky. Of course, if you have any symptoms like chest pain, shortness of breath, palpitations or funny heartbeats, dizziness or passing out, or if you have hard to control blood pressure, cholesterol, or diabetes, it's a good idea to see a cardiologist. Otherwise, if you have a family history of heart disease, particularly if it has affected younger family members, you should consider seeing a cardiologist to discuss screening. One very useful test is called a calcium score. A calcium score is a CAT scan that does not use any dye and checks to see if you have any plaque around the blood vessels of the heart. Plaques, or blockages, can lead to heart attacks or strokes. So if they are found, it is important to discuss healthy lifestyle changes and consider medication to help prevent complications. A calcium score is useful because it can pick up early disease that may not be causing symptoms. On the other hand, a calcium score of 0 means you have a low risk for coronary artery disease. If your score is 0 and everything else, like your cholesterol level and healthy habits, stay the same, you can repeat the test in 8 to 10 years. There are also blood tests called advanced lipid testing, which can help better understand your cardiovascular risk. These tests take a more thorough look at your cholesterol and may indicate that you have a higher cardiovascular risk than your regular cholesterol panel would predict. We can also check for very low levels of inflammation. We think that inflammation can lead to heart disease, so detecting these low levels can get us more information about your risk. Historically, we have thought about cardiovascular disease as affecting men more so than women, but we now know that women are certainly affected and may present differently. I often see that cholesterol levels change around menopause, so that is a time when women should consider evaluation if they haven't already. Making decisions about reducing cardiovascular risk before menopause should include a discussion about family planning, because a lot of the medications used to decrease risk of heart attack and stroke cannot be used in pregnancy. Deciding which tests are appropriate is an individualized decision, and your primary care doctor can help decide whether or not it is time to take a deeper dive into this discussion with a cardiologist. I hope that you have found this useful.